Okay, so we are going to be discontinuing a continuous IV and moving to just a lock. So I would start by doing my 6 rights. So right patient, right medication, right dose, right route, right time, right documentation. And then I would go into my MAR, check the physician's orders, make sure I know what I'm supposed to be doing. And then I would prepare my supplies. So I need a saline flush, alcohol, gauze, and then I would go into my patient's room, do 2 patient identifiers, so name and date of birth. Then I'd wash my hands, get on a clean pair of gloves here. Right. Okay. And as I'm doing this, I want to be sure and check the IV site, make sure there's no reactions, make sure the line's still patent, the IV is still correct or placed correctly, and then I would clamp my primary tubing set here. So make sure I clamp that off. There we go. Okay. So now, okay. And I should have got all this stuff ready before I put my gloves on here. Okay. All right. So we'll start by removing the tape. Right. And throw all this stuff in the garbage as we go. Here. Okay. There we go. And then we'll remove this tape. Okay. And then we'll loosen our chevrons here. Okay. And we want to be sure this whole time to hold this in place, because we still need it there. We don't want to rip it out. Okay. Alright, maybe if I can ever get the tape off of it here. Okay. And then, alright. Almost there. There we go. Okay. Alright. And then we would take and place a clean piece of gauze under this here. Go. Alright, and then we'll disconnect our primary tubing here. Alright. And then we will clean off this port with a clean alcohol swab here. So there we go. Alright, and then we'll get our saline flush ready. And administer this slowly. Okay. And we'd want to be sure and do it slower than that. Okay. So there we go. Loosen this. Okay, make sure that's the correct placement. And take this down here. Okay, and then we want to be sure and teach the patient how to maintain a saline lock, keep it clean, that kind of thing. And then we'd want to document any pertinent data. So, and then we'd get all this stuff cleaned up. And then we are also going to be doing a, we're going to be administering 1 milliliter of Dilaudid over 2 minutes. So we'd go out, check our MAR, redo the 6 rights, so right medication, right dose, right route, right time, right documentation, right patient, all that stuff. And we'll prepare this here. Okay, there we go. And then we'll clean the top of this with the top of our medication after we check the expiration date, all that kind of stuff. Clean the top. Draw in 1 liter of air. And we'll get our medication drawn up here. Okay. Recap our needle. Perfect. All right. So we put this stuff in our patient's room. Identify the patient using 2 patient identifiers, so name and date of birth. We'll explain to them what we're doing. So we're going to be giving Dilaudid. Then I'd wash my hands. Get on some clean gloves here. Okay. This open already. This one. Okay. And then we will take and clean the end of the saline lock. And then we will flush it with 5 milliliters of saline here. Okay. And you do this nice and slow. Okay. So uncap our needle here. Attach that, and then we will administer over 2 minutes. So push a little bit every like 15 seconds, wait another 15, push a little bit more, and be sure to get the full medication in the 2 minutes. So once that's done, dispose this in a strap container, garbage, and then we will flush again with 5 milliliters of saline. All right, and it's a slow push. Okay, so there we go. And then you want to be sure and monitor the patient for any adverse reactions. Always want to check your IV site, make sure it still looks good, everything's still placed correctly, all that kind of stuff. And then we go back and document. So then our next task is going to be to discontinue an IV. So we will go back to our MAR, double check our physician orders. Obviously I would have these gloves off now, but prepare everything we're doing according to the 6 rights. So right patient, right medication, right dose, right route, right time, and right documentation. And then we would go into our patient's room, identify them using 2 patient identifiers, let them know what we're doing. So we're going to be discontinuing their IV lock. So we would start by assessing the site, making sure everything still looks okay. There's been no reactions, anything like that. And then we'll open up our gauze here, so that's ready. And then we'll remove our previous dressing after I performed hand hygiene and put on clean gloves. And then we'll take the gauze out. Okay, and then we'll want to be sure to apply pressure. Okay, here, I'm gonna have this a little more ready. There we go. Okay, so apply pressure, pull back, dispose of that in the correct container. Place the gauze, keep holding pressure for at least 15 seconds. And we'd want to look at our catheter, make sure it's intact. There's, you know, no fraying, anything like that. The whole thing's there, just to be sure that there's not any of it left in our patient's arm or something happened that we didn't know about. And then we can apply a piece of tape, keep that pressure on that site. All right. Then we'll leave our patient in a comfortable position, make sure their call light's in place, and then we will go back and document everything we did.